Dr. Kyle with Project Wellness Company. Today what we want to talk about is upper back pain and tension. And if you're ever notice where you get really tight up across the tops of the shoulders, or you've noticed that there's tension, trigger points, muscle spasms, things like that up and through there. For us, what that could indicate is there's some structural stuff going on in the neck, because ultimately when we look at the muscles in the spine, okay, we have the base of the skull that sits right here, muscles coming down into the top of the shoulders attaching here. And if there's a structural problem in the neck where we are starting to lose the curve, where it's starting to come forward, if you notice, the distance from here to here, that's going to be your muscles, okay? And it's holding your head back. It's keeping your curve where it needs to be. But if we start to lose that and that head starts to transition forward and our posture is pulling forward, okay, that's going to take and elongate those muscles and it's going to stretch them out. And so that's where those trigger points, those muscle spasms, those tensions across the top of shoulders are going to come into. And ultimately, when we look at that, if we take that curve away from the spine, instead of having an actual spring, when we walk, we run, okay, if we lose that curve, now all that force is going to be jammed through those bones, and what's going to cause is arthritic and degenerative conditions over time. And essentially your head, okay, is about the weight of a bowling ball. So when it's back up over the shoulders, it's going to be 10 to 15 pounds. And for every inch this head starts to come forward, it's going to gain 10 pounds of pressure. So instead of being 10 to 15 pounds, we could be 20, 30, 40 pounds. And that's a lot of tension on these muscles on the backside. And I'll just go back. A lot of tension on these muscles on the backside. And so correctionally, what we want to do is we want to get that curve to come back in the spine, take tension off of those bones, those discs, put the weight on the posterior side of the spine back here where it's supposed to be, because those are our load-bearing portions of the spine. And that's going to ultimately help to correct the arthritic and degenerative conditions that would be started in the neck. And it's going to ultimately take pressure off those muscles on the backside. They're going to start to relax because they're actually holding that curve in the spine where it's supposed to be, ultimately getting rid of that tension and those trigger points that are coming in across those shoulders. And so that's something that we deal with on a day-to-day basis within the office through the different therapies and exercises that we're doing, and teaching patients things that they can be doing not only in the office but at home in order to correct that. So that way they're not always dealing with that tension and those trigger points across the top of the spine.